So I think some of the important steps forward for vascular surgery were the combination of our society with the Society for Vascular Nurses and the Society of Vascular Technologists, and the inclusion of our colleagues in interventional radiology, which over time has really improved the quality of the meeting and the care of vascular surgical patients in the UK. I joined the Vascular Society as a council member and spent 4 years under Peter Bell, Roger Greenhalgh, Roger Baird, and then Barrister Sam. At the end of that, I was elected to the position of chairman of the Education and Training Committee. And it was at that point that we decided that there was a need to move towards a new speciality. And in that year, I went to see Sir Peter Morris and a friend of my father's at that time, Sir Liam Donaldson, who was the Chief Medical Officer. And I put forward the concept of the new speciality as we had devised through the society itself. And it took probably the best part of 4 years of really hard work through the successive presidents to gain a foothold in the door of both the colleges and the Department of Health. And thereafter there have been a whole succession of presidents who've worked tirelessly towards the generation of the new speciality. And that was achieved back in 2012 with a new Act of Parliament. And in this year, we've appointed our first 20 national trainees at ST3 level. And I'm pleased to say that half of them are women. So we are moving forward for vascular surgery as a new speciality. The speciality itself has a new curriculum, and the curriculum is wide-reaching and covers all elements. And there is a section on mesenteric reconstruction. Albeit rare, I think it still remains probably one of the most challenging surgical operations that we face on rare occasions, usually at the middle of the night. So clearly your expertise in that area is welcome, because I think when people read about mesenteric reconstruction, they remember the name of Adrian Marston.
Nice to say that.
Thank you. Now, I'd be really interested to know about the Sol Cohen Prize, which is the Founders Prize at the Vascular Society. It's given for the best clinical piece of work each year, and I suspect for a large number of members, unaware of Sol Cohen and his background.
Well, Sol Cohen was our first president, and he was a charismatic, colourful figure, a charming man, a very orthodox Jewish man, very proud of his Jewish heritage. And he practiced in Dartford, at Joyce Green Hospital, Dartford, where he set up a small vascular unit. And originally it was a sympathectomy. He was a renowned sympathectomist. But gradually he became aware of developments and started, in a small way, the femoral artery reconstruction. And because of his personality, we all liked him. He was a very successful, very charming first president.
What was the nature of the femoral artery reconstruction in those days? Was that a sort of simple endarterectomy or a
It was endarterectomy. It hardly come in. Endarterectomy was a Portuguese invention. It came in round about 1950s, early 1950s. English Monish. No, the femoral artery reconstruction was either the reverse Cephalus vein or a Dacron tube, a synthetic plastic tube.
And was the disease then principally located within the common femoral artery?
The disease was almost between the common femoral artery and the popliteal. It was the middle section of the superficial femoral artery.
Right.
And thrombosis usually started at the adductal canal and then extended upwards.
Right.
That was
And the sympathectomies they performed at that time, was that a lumbar sympathectomy done openly, or did they use chemical agents at the time?
No, it was almost invariably an open lumbar sympathectomy, retroperitoneal approach, push back the peritoneum, expose the sympathetic chain on either side and scratch it out.
And so how much would they take out? Was it from
about 5 centimetres.
Right. And what were the results like with that?
Well, of course, I mean, is a physiologically flawed idea, because what it did was to divert blood flow to the skin vessels and do nothing at all to the problem of claudication. So it wasn't expected to work. It did. It certainly warmed the skin a little bit, but I suspect that there was a very strong placebo effect.
And in terms of the complications they saw with it, did they not see these sort of hypersensitivity syndromes that you sometimes see after sort of chemical symphylectomy?
Yes, gustatory sweating, yes, there was a certain amount of that. But on the whole, it was a reasonably straightforward operation. Now I think largely historical.
Very much so. I thought I'd do a short talk about the Vascular Society logo, and this is an original, or the original logo that was given to the Society by Felix Escott, and in his compliment slip that he'd sent to us from the Lindo wing at St Mary's, he had written, this famous image came to me from ADW, that's Dixon Wright, famous surgeon in London, himself many years ago, and the artist was one of his drinking pals, and he seemed to recall that it was done at the time of a Saints and Sinners dinner at the table, and on the back you can see that it's signed, "Thought you might like this, it's a artery dancing with a vein, Dixon Wright, 31st of October 1967. And today Adrian is wearing his original vascular surgery tie. In 2014, after our rebranding and our new logo, this is the tie for hopefully the next few years, and you can purchase it at the stands, and it only costs you £20.